Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Leflunamide. Leflunamide is a prodrug, thus it needs activation. Leflunamide will inhibit dihydroorotate dehydrogenase, and it also inhibits thymidylate synthase. It inhibits dihydroorotate dehydrogenase and thymidylate synthase. It also inhibits T cell proliferation, and B cell antibody production is also inhibited. So this leflunomide is actually, it is a long acting agent, and it is as effective as methotrexate in the treatment of rheumatoid arthritis. Then the side effects of leflunomide are always similar to methotrexate. So because of this similar side effects, leflunomide should never be combined with methotrexate. So other side effects are, it can cause diarrhea, it is teratogenic. So because it is teratogenic, it is contraindicated in pregnancy. It causes hepatotoxicity.
thank you and thank you for watching.